for joining us. I'm Noah Duff from Sabin Vaccine Institute. This interview is part of Sabin's Pivoting in a Pandemic series, which captures stories of extraordinary leaders who are adapting to advance research and protecting public health in the midst of COVID-19. Today, we have Dr. Samir Saha, who is a professor and head of the Department of Microbiology and the executive director of the Child Health Research Foundation at the Bangladesh Institute of Child Health at Dhaka Shishu Hospital in Bangladesh. Welcome, Dr. Saha. So if you could first briefly tell us what you do in your roles as head of the Department of Microbiology at Dhaka Shishu Hospital and as the executive director of Child Health Research Foundation.
So I have two hats, in fact. One is the Dhaka Shishu Hospital and other is the Child Health Research Foundation. Mostly I work on the pediatric infectious diseases, and then Dhaka Shishu means pediatrics. So, and it's the largest pediatric hospital of the country. So all the microbiological specimens are really coming to this lab. And our main role to process all those specimens and make sure that specimen results are going to the clinicians at real time so that they can really do the management and treatment, all those things, evidence-based. That's what we do. That's one. But we leverage that specific data that's coming to our lab also for research.
So describe yours and your lab's research areas, projects, and current interests and how COVID has impacted this research.
Unfortunately, when the COVID came, everything really disrupted. And we could not really continue to work. And we were very nervous at the same time, because in Bangladesh, it came very late. And it came late by that time, knowing what is going on in China, what is going on in European countries, the large number of deaths, especially in Europe. So that's really made us nervous. And we stopped everything in the March. But at the same time, when we stopped, then we all got really scattered, and then we had a briefing with all our team members. Okay, be at home and let's work from home, and we'll be writing the papers. That's what our plan. But suddenly we saw that an influx of people are coming from Europe, coming from US, coming from Middle East. All of them are coming to Bangladesh. And they were carrying those really viruses. And it was impossible for the country, for the government, to really prevent those, to really quarantine them, to really put them in isolation, because we are not really a rich country. We are really a resource-poor country after all. And number one, we did not have any experience of this. I think this is true for all of us. So ultimately, they all really mixed up with the population, and it started spreading. So then only one laboratory was testing the specimens, and government was little reluctant to really bring other labs also to work on this. But then they gradually realized it will be impossible to manage these pandemic by really testing in one lab. So they started spreading it to labs. So it's possibly 5 or 6 labs, but all of them were government. And exceptional was Child Health Research Foundation. The government really, from the very high up, they said, okay, this is a very good lab, so we should really also allow them to work. So that was the beginning. And remember, as I mentioned before, we all said that we will be not really doing anything in the lab. We all will be working from home and we'll be making the publications, so they're writing the papers. And that's what we are planning. But the volunteers of Child Research Foundation, I can say the frontiers, they really came up and they said, no, we have to participate in this. And we started working 24/7, 3 shifts a day. And we really converted our study area completely to a COVID lab. And how was it possible? It was only possible because we have the habit of leveraging one thing to do multiple things. So we converted our lab, and then we collected PPE, all those things, and then we started working it. But first few days was really, really frustrating. We were getting one specimen, two specimens, there is no specimens. So we started advocating and we started training people, sometimes in person, sometimes by virtually. So we really trained 16 different hospitals, team members. And gradually, those hospitals were sending specimens to us. So when they are sending specimens to us, we have started getting more and more specimens. And at some point, we started getting 300 or 400, sometimes even 500 specimens in a day. And we are doing all those specimens at a time. So it's a whole day. We are really doing a lot and day and night. So that's the way we started working for the pandemic time, in fact, but nothing with our beloved um, research projects.
Yeah, so speaking of those research projects, so what were you guys able to continue to work on those, or did those kind of all activities halt there? What's the current status of your other research projects?
Other research projects is completely on halt, in fact, because nobody was really going to Dhaka Shishu Hospital. It was only Standard Research Foundation lab. So it was only lab person, no doctors, clinicians who are really going anywhere. So there was nothing the research lab.
So can you speak a little bit more to what some of the public health risks are to the disruptions in resources and research as your resources have needed to pivot to handle the pandemic?
It is really the multiple impact of this pandemic. The one, we are really ignoring a lot of things. As I mentioned, the hospital where people are coming to take care, take the service or take the treatment, there hardly any patients who are coming. So something is going on. Well, it's not that all infections are gone, but they are not getting the treatment. We really do not know. If we look at the previous pandemic, historical things, then you will see the death rate are really huge during the COVID time compared to the pre-COVID time. But this is not all these deaths are due to COVID, due to the other diseases as well, which are not really uh, getting the treatment on time. So this is one kind of challenge. Number two, if you consider the EPI program, the EPI program is very famous for Bangladesh because we are one of the best in EPI. But how can we do do this overall EPI program? How can we run that EPI program? Because if we run the EPI program, maybe many of our volunteers who are really helping this to manage the EPI program, immunize the children, they may get affected or they may get infected, and that will be creating even a bigger problem. And it is sad that we were ready to immunize for the campaign of measles during just before COVID time. And we really sent all these vaccines in the remote area so that we can really immunize them. But unfortunately, due to COVID, we still cannot do this. So we are not sure that how the measles will be going on in the coming days, because at the certain time later, we always do this campaign just to make sure there is no measles outbreak. So this is one, but there are also many other infectious diseases. We don't know really that what is going on with the pneumococcal diseases, because we know if we don't give the vaccine properly, that maybe the other non-vaccine type may emerge, or the vaccine type even may emerge if we cannot give the vaccine. So diphtheria is another one, pertussis is another one, which can be a challenge. And in first 2 months of this pandemic, we have the vaccine coverage really was very, very low. It's about 50%. But now we are really doing much better. It's about 80% now. So we are overcoming those. But still, I think still we are having a very big challenges because in the urban area, it is a bigger challenge. So we really do not know, but maybe we'll be knowing later and we may see outbreak at any time. Yeah. And if you say about the preparation, I really do not know how much my API can do because API is helping a lot to this COVID work as well. For example, the transports by which the specimens are going from one place to other, or the other supplies going from one place to other, everything done by EPI. The EPI volunteers are also helping the COVID team just to make sure that they are getting collecting the specimens and sending it to the labs. For example, at our lab, we are getting the specimens for about 40 or 100 miles distance. And all those are mostly done by the EPI team members. So EPI really doing their best to manage everything, but it is so difficult for them to manage. So I am not sure, in fact, what kind of, if it continues longer, this can be a bigger problem to us, in fact. Yeah.
It seems there might run the risk of potential dual pandemic with both COVID and some of these other diseases. So is there anything in your view that vulnerable communities can do to prepare for the possibility of a dual pandemic, and how might research be able to assist those preparations?
So I'm also a National Immunization Technical Advisory Group member, and we are having a lot of discussion about it. And we really trying to make sure that is the way really from 50% to now it is more than 80%. We have started it. But even, and you know that there is a flood also recently in Bangladesh, and that is another problem. And I can see some of the photograph from our EPI members and EPI managers that they are taking the boat, and with the boat, they are going to one house to another house to immunize them. So we are doing our best, but I am still worried that what is going to happen. I mean, some of them may be getting one dose, some of them getting missing some of the doses. So maybe we'll be seeing those, but EPI is really aware about this. They are doing their best. As I mentioned, they are not really relying on the road transport only. They're also using the boat. And I have seen multiple pictures that the mothers, the other thing I should say that it is not only EPI team, it is our mothers. It is the pro-vaccine population in the country. So mothers are really coming whenever they are knowing that someone came with the boat and the vaccine is there, they will come and they will be on the boat and they will be taking the vaccine there. So that's the way things are going on. So we are doing our best, and we are aware that this kind of problem may come. So hopefully we'll be able to protect a lot, but still we should be more and more careful. And whenever we are in the meeting, in the NITAG meeting, we discuss about these issues. So all our the country policymakers are now working with Gavi, WHO, different donors, Gates Foundation, and all those, just to make sure the COVID vaccine is coming to Bangladesh. And if they can really prevent COVID cases, then only they can go for others. So we are doing our best, in fact, honestly. And I believe that we'll be maybe one of the low middle income country who will be getting the vaccine.
Well, Samir, that is all the questions that I have for you today. Thank you so much for your time. We appreciate the work that you and all of your colleagues and your team are doing. And we wish you the best of luck. So thank you.
Thank you so much. And I also thank Savine for taking this initiative. Thank you so much.